Cancer incidence. In 1900, cancer was practically unheard of. By 1950, there were about 150 cases of cancer per 100,000 population. In 1971, Nixon introduced his war on cancer, opening the floodgates of massive research funding backed by the government. This situation escalated until about 1980s. Over $50 billion per year was being spent to find the cure. We're hit with the endless media stories about progress in the war on cancer, with new breakthrough drugs and miracle procedures being right around the corner, and of course the ever-present new experimental drugs offered to almost every cancer patient. It's astounding how each new generation of cancer patients keep falling for the same lame rap year after year after year. A combination of fear and ignorance is what keeps this train rolling. What is the real story behind here? From the U.S. government's own statistical abstracts, we find the disconcerting truth. The simplest thing is to look at actual deaths from cancer. Epidemiology in deaths from disease are always measured in deaths per 100,000 population. So let's start back in 1967. Mortality from cancer in the U.S. Year and deaths per 100,000. 1967, it was 157.2 thousand. 1970, 162.9 per 100,000. 1982, 187.3. 1987, 198.2 per 100,000. Those are deaths. 198.2 thousand deaths per 100,000. 1998, 198.4. 1989, 200,201.0 deaths per 100,000. 1990, 203.2. 1991, 204.1. 1992, 204.1. 2011, 191.4. Okay, but as you see, it had a steadily increased rates of people dying from the disease. In 2011, it went down just a little bit from 204 to 191. Okay, these are the source comes from the Vital Statistics of the United States, Volume 2, 1967 through 1992. It also comes from the National Statistics Reports, Volume 61, number 6, October 10th, 2012. And I will provide this information in the description box below for all of the videos. Don't get too excited about the 2011 figure. In the government numbers games, it's anything but pure science. The objective here is to often to obscure reality, not necessarily to reflect it.
Independent analysis by the CA Journal for Cancer Clinicians, January 97, put the 1993 death rate at 220 per 100,000. Does that sound like progress? Yeah, progress for the disease. Jumping ahead now to 2000, the overall rate had climbed to 321 per 100,000. OECD Health Data, 2010. All this is quite different from what the CDC now claims. Overall, 178 per 100,000 as of 2007. Perhaps that's because CDC figures are strictly controlled by their investors from the drug industry, now more than ever before. Why does nobody know this? Bet you never saw these charts before, because they are forbidden in mainstream media. Numbers can be twisted and made to do tricks. This chart is the raw data, not age adjusted or divided by race or type of cancer. It will take you hours to find the simple data by internet searches, because the uncomfortable truth is deliberately obscured by overcomplicating it into dozens of useless categories. Try finding a medical reference or journal article or a URL that admits these figures. Try finding a newspaper or magazine article in the last 15 years that uses the raw data. And this data says one thing: more people are dying of cancer now per capita than ever before. And nothing is slowly the increase. And this data says one thing: more people are dying of cancer now per capita than ever before, and nothing is slowing the increase. Not early detection, not better screening, not new high-tech machines, not radiation, not surgery, and definitely not chemotherapy. All the journal articles will say the opposite, that cancer rates are falling. But when you look closely at the data they cite, it never stands up to scrutiny because they twisted the numbers by selecting only those groups who showed the assigned outcome. Unfortunately, the general population continues to have more deaths from cancer, not less.